afternoon, everyone, and welcome to the Department of Trade and Industries live show, Ready to Recover. My name is Bea Everdone, and I will be your host this afternoon. Hello to everyone, and I hope that you're all doing well, and I hope that you are all safe. Before we kick off the show this afternoon, I'd like to invite everyone to maybe give yourselves a little tap on the shoulder. That's right, because you definitely deserve to congratulate yourselves for winning, even if it's just a small win at home, at work, or just being present with us here today. That is a huge accomplishment for all of us. So, guys, give yourself a little hand of applause, maybe, and congratulate yourself for being here with us today, because today is a very, very special day, because this live show this afternoon serves as the launching of DTI 7's digital channel. That's right, we're going digital. DTI 7 is going digital with a Ready to Recover channel. DTI 7 is bringing their events right on your screens for a wider scope, therefore involving everyone to participate in community and economy building. So, guys, expect that there will be a lot of learning sessions for all of you, so we would be able to help ourselves and fully say that, hey, we are definitely ready to recover. All right, kung nahibong mo nga nung nagtapok-tapok ta karong hapuna, no, o kung unsa ni ang ato ang live show karong hapuna nga gipanguluhan sa DTI Region 7, we will be discussing and tackling the importance and the benefits and also the good effects of contact tracing. That's right, contact tracing, ladies and gentlemen, pinaagi sa atong mga invited speakers. Our speakers this afternoon will be talking about our topic, which is understanding contact tracing for safer communities and faster business recovery. That's how important contact tracing is, ladies and gentlemen, because it will not only benefit the community, but also the business sector and the economy as a whole. And if you guys want to learn more about it, stay tuned. A lot of us and a lot of experts are going to be talking to you about it. So without further ado, atuan ang sugda ng atuang live show this afternoon. May I call in Miss Asteria Caberte, the Assistant Secretary of the Department of Trade and Industry Region 7, to formally welcome us all into this afternoon's show, Ready to Recover. Ase Caberte, take it away.
Thank you, Bea. To our esteemed resource speakers, Dr. Nina Gloriani, Chair of DOST Expert Vaccine Panel on COVID-19 Vaccine Clinical Trials, our very own Albert Padin of SIMF, of course, to Mayor Benjamin Magalong of Baguio City, Attorney Amor Venenoso of the National Privacy Commission, the business sector, stakeholders who are here with us this afternoon, our DTI family guests, ladies and gentlemen, good afternoon. First of all, I would like to thank all of you who are here with us on this virtual active event for today's forum. I would like to extend my gratitude to our partners in public service, the Department of Science and Technology, and the Department of Information and Communications Technology. And a big thanks also to the Philippine Chamber of Commerce and Industry, PCCI Visayas chapter, led by my very good friend, Mr. Ed Du. He heads the various chambers in Region 7, and I understand they are presenting to us as a document of support to show support to this event. They have a resolution of support. I also thank ARD Nanette Arbon for mounting this event this afternoon. Okay, so just when the Philippines was finding its way in the grooves after the decades in the economic wilderness, along came COVID-19. During the past 5 years, we were in a very good trajectory. Growth averaged more than 6%, in fact 6.7%, and was projected to exceed 7% this year. And then COVID came. Now we are at negative 3.4 growth decline. Moody's Investors Service slashed its gross domestic target or forecast for the Philippines to a negative 7% level this year after a deep recession in the first half dented hopes for quick economic turnaround. Because of this health crisis, a lot of our businesses were closed, commercial events and trade fairs were canceled, several of our establishments have been badly hit, and that is an understatement to say that they have been badly hit by the pandemic, particularly our large retailers, malls, restaurants, barbershops, salons, and other non essential businesses. In the 3 months of the crisis, I remember DTI's staff not just went to establishments to do implementation of the price freeze. It was really crazy monitoring on price freeze when we couldn't even go out. We also had to assist DOH in the implementation of health protocols. And this
Ito.
created a stigma. At the same time, the agency had to take care of its field staff, provide PPEs for them to be able to deliver the service safe. Now that the modified General Community Quarantine or MGCQ status is now in place in the whole of Central Visayas, we anticipate an increase in business activities and movement of people. But we are not seeing that. Businesses are now open, malls are, tourism is slowly opening up, but not but the much needed foot traffic for our business sector is not there to support them. We have to restore the consumer confidence that we need. This is why we are here this afternoon to put our acts together to jointly put the the consumer confidence back. So you see, this is how important this webinar is to business recovery. Expect to get a lot of good information from our speakers. We have carefully selected them for you to be able to get some ideas on contact tracing. Our chat show, by the way, is currently streaming live simultaneously at DTI 7, DOST 7, and the CT 7 FB pages. Community involvement is critical to this project's success. I hope that this webinar will spark business sector-led movement for the adoption of smarter and better contact tracing methods. Just to highlight to the organizers and to ARD Nanette, when I presented this yesterday to the regional IATF, we got the excitement and the commitment from all the members that they are all here with us this afternoon, including the chair of the regional IATF, the RD of the ILG, DOST, of course, and DOH and the Department of Labor and Employment and the PNP and the Philippine Army. They are all here. Who they would like to learn also from this webinar. So without further ado, I formally welcome everyone to this virtual forum on understanding smart contact tracing for safer communities and faster business recovery. I said I cannot stay for the panel discussion, but I am definitely stretching my stay here. I'm here to listen up to the time that I will be called to that other meeting at the other link that I have. So thank you everyone, to all our speakers. Good luck and congratulations for this. Thank you. Back to you, Bea.
All right, taghang salamat Ase Caberte for that very, very warm welcome. And we're very happy that we are joined in by other offices and at the same time, live viewers on Facebook who are watching us from all over the Philippines. Our friends from Negros Oriental are watching us. Some friends from Luzon are also watching us. Thank you so much for tuning in, and we're excited to be with you this entire afternoon because we assure you an afternoon filled with learning. So now, to further explain to us kung unsa ni ang bagong initiative sa DTI 7 kabahin sa contact tracing, atong paminawon og tagaang masipang pakpak si Miss Nanette Arbon the Assistant Regional Director of DTI Region 7, to give us the rationale of this initiative. Take it away, Ms. Nanette.
Thank you, Bea. Good afternoon. Again, welcome to this webinar on understanding contact tracing. This initiative was conceptualized by DTI and its partners, the DOST, DICT, PCCI Region 7, the Negros Oriental Chamber of Commerce and Industry, Rotary, and the SMED Council. We thought about this after observing long lines of people outside business establishments. These long lines were caused by people writing on logbooks for purposes of contact tracing. We thought that there was no reason for this, as the technologies for contact tracing are already available. Most of these technologies are even available for free. And that is why we are here today to learn about the science of contact tracing, the technologies that are there that we can adopt, learn from the best practices of Baguio City, and understand how we can protect data privacy in contact tracing. This webinar is the first of a three-part series that will be running over the next 3 weeks. So today, September 11, we're running this webinar on understanding contact tracing. 2 weeks after, on September 25, we will hold a pitch party on contact tracing apps. Already, we have like 11 contact tracing apps that we have identified, and a lot of them are already signing up for the pitch party. And then on October 2, we will have an online DIY workshop to teach business establishments or people how to make their own QR code enabled system. So we hope by doing this, we win the hearts and minds of the business sector and our consumers to adopt digital technologies in contact tracing. Already, we are getting positive responses from our business sector, as mentioned by my boss, Asek Asker. There's already a move from the local chambers in Region 7 to support this initiative. And of course, LGUs are already online, and the regional IATF is there also behind us. So, without much further ado, I would like to thank you for being here. Please stick with us for the next 2 hours and enjoy. Back to you, Bea.
All right. Thank you so much, Miss Nanette. We're very, very happy that this initiative is happening here in the Philippines, and it will definitely help us in community and business building. So, guys, this afternoon is going to be jam packed. Now, the question I am going to ask everyone is, are you all ready to recover? You should, because we are going to get the learning started as we first tackle the science of contact tracing. Our first speaker is a clinical microbiology consultant at St. Luke's Medical Center in Quezon City, DOST expert vaccine panel on COVID-19, vaccine clinical trials chairperson. She is also a member of the World Health Organization Scientific Steering Committee for COVID-19 Solidarity Vaccines Trial. Wow, I'm excited to learn from this one. So, guys, please help me give a warm welcome to Dr. Nina G. Gloriani. Take it away, Dr. Nina.
Thank you very much, Bea, and good afternoon to the honorable heads of the different agencies. So it's DOST, actually it's DTI who's actually sponsoring this mainly. So may I now share my slides? Okay, wait just a minute. So, okay, sorry. So we have this outline. I need to define at least 2 terms. Then we look at the chain of transmission and how to break that chain, understanding how to break that chain, looking a little about infection, infectious period, potentially infectious interactions, and quantifying SARS-CoV-2 transmission. Okay, then we look at principles of exposure, looking at distance, velocity, force, duration of how these droplets are actually propelled by the one who is sick. Then we try to cover the COVID-19 disease spectrum because these are all important in breaking the chain of transmission. Then we look at parameters of the infectiousness model, how to reduce R naught or the reproductive number, and just some summary statements. Okay, so for the first definition, we have the index case. This is the patient. This is the one who has the sickness, the illness. So index case is defined as the first documented case of an infectious disease in a population. For this purpose here, this is COVID-19. So we have here this SARS-CoV-2 virologically confirmed patient who can in fact infect many other people. The index case may also be called patient zero, parang ground zero, no? He is the first documented patient in a disease epidemic within a population. So we have that index case. We want to trace who could have been infected by that person, by that patient. So we define what is contact tracing. It is actually one of the major public health interventions where an index case with confirmed infection is asked to provide information about contact people who were at risk of acquiring infection from that index case within a given time period before he actually knew that he was positive. So this is here. So he may have contacted many of these people and actually may have infected so many before he actually knew he was positive. Now, contact tracing aims to identify those. So all of these may be those people that the virus may attack next. So next. Contact tracing will also detect the trail of the virus movement. So where does it go from person to person or from population to population, from region to region, and so on. So it aims to identify and alert people who have come in contact with a person infected with COVID-19. It aims to break the chain of pathogen transmission. So we want to break that COVID-19 transmission. So this is the chain of transmission. I'm sure you're already familiar with this, but we do have this index case. So the chain of transmission goes further down here. There may be not just two contacts, but there may be so many other contacts and down the line. And what do we want to happen is to break that chain of transmission. So we do not want this infected person to infect others. Okay, so let us understand how we can break that chain of transmission by looking at defining a few things for you. So what is infection? Infection is exposure to, for instance, in this case, it's virus, droplets. We may be looking at virus numbers, viral particles over time, but there will be other dimensions that I will be talking about later. So we refer to a term infectious dose. We need a certain number of virus particles to be inhaled in the case of COVID-19 over a time period before it can actually cause infection. For example, just a normal inhalation or when you touch eyes, your mouth or nose, and your fingers are contaminated, you need 1,000 viral particles in order to get the infection. But if that is just that moment, okay? If you inhale maybe the droplets or the aerosol over a longer period of time, let us say 10 to 15 minutes, that number can go down to 100 viruses. And if the exposure is even longer, it can even go down to 10 viruses or less than 10 viral particles. Let us say those people who are in work areas working 8 hours a day in closed spaces where there are many people, or even if there are just a few people, when there is that's not shredder, it's shedder or a spreader of the virus. But let me also take you to this possibility of super spreaders being around you. So these are carriers of the virus, able to transmit the virus easily, and more people are infected in a shorter period of time. So these dimensions that we need to understand when we do contact tracing. And generally, the sicker and weaker the patient, the higher the viral load, and the easier it is to infect others. So another dimension of the spread of disease and transmission is when there are susceptibles. Of course, it is the susceptible people who will be affected first. But take note here, well, if there is someone immune, not that we know much about COVID immunity right now, but there could be some who are immune. The immune may not get the infection from this primary patient or patient zero, but he may infect somebody, and that somebody who is infected may have subclinical infection, meaning infected but does not show any signs and symptoms. So this particular, this pink here, the subclinical patient can infect others without him knowing it. And of course, well, the rest are okay because you know they are infected. They show symptoms, they're clinical. Okay. So recently, we've had the pandemic already for 6, 7 months now. And recently, it has become a rule of thumb, especially in the healthcare setting, when we consider distance and duration of exposure in um, actually deciding on what to do with the contacts or those who were exposed. So the rule of distance of 6 feet or 1 meter from source, if the exposure was that much or less, and a duration of exposure but at least 15 minutes. But we do have to consider velocity, the force or trajectory. When somebody sneezes or that patient who is a primary case sneezes, coughs, even talks, so we had to consider all those. We can actually quantify SARS-CoV-2 transmission by looking at the particular modes of transmission. Is it through droplets? Droplets are bigger particles. If we look at here, more than zero point 0.1 millimeter in size. Of course, they will move not as far as the smaller ones. So we also have the aerosol here, less than 10 micrometers. And then we can also look at COVID, the droplets or the virus present on contaminated surfaces. And there is also that possibility of a fecal oral route. So we will go back into this velocity, force, trajectory. Just take note here. When you cough, velocity is the droplet will travel 10 meters per second. And if you sneeze, I think this is even more forceful than a cough. It travels at 50 meters per second. So, but the bigger ones would come down, and that is the reason for the 2 meter, the 2 meter guideline that we have to follow in our physical distancing. But that can change, and that can actually may not be correct at all in certain circumstances. So there's more of that here. I just want to show here. I think here, if you are too close to each other, then of course all of these droplets will just be around you, and you can just inhale them without, if you do not have the proper precautions. So, and in here, in this right panel here, the green area, they have done high-speed video to show the main components of a sneeze to study the spread of diseases. This was back in 2014, so even before COVID-19. So the green area, note its trajectory. The green area is a shower of larger droplets that may extend as far as 6 feet. Then the red area is a particle-laden cloud of smaller droplets suspended in moist warm gas. And there could be smaller particles, maybe not actually very much visualized here, but these smaller droplets carrying the largest pathogen load stay in the air longer and travel farthest. So research from China actually showed that SARS-CoV-2 can exist in a ventilated room in a patient's room. So there are certain situations that will increase exposure, and of course we understand this. So in the context of the Filipino people, our lives here in the community. Any crowded facility, markets, especially Talipapa. You can look at Talipapa. They're really very crowded. Malls, well, they're not as crowded as before, but you do not hold conventions anymore. Well, some people still hold sabong, and thankfully we do not have concert halls. But in the Philippines, especially in Metro Manila, there is a lot of multi-generational, crowded multi-generational housing. So in the areas of Tondo, Caloocan, so we have all of those people living so congested, so near each other. And then, well, this is also possible. The group home boarding house, it's good that students are not in attending face-to-face classes now. We do have long-term care facilities, correctional facilities, and homeless shelters. So we have to consider all of those. So one is exposed, he may get the infection. If he does, he may be looking at three possible scenarios. The COVID-19 disease spectrum shows that there could be an asymptomatic infected person, so infected, but he shows no symptoms. And this person may actually remain asymptomatic until he recovers. By that time, we may be able to detect antibodies. So this is a window period here. If we look at here, this is the asymptomatic stage. Note that the virus is there. You may actually detect it, but the patient or the person has no symptoms whatsoever. And from a public health point of view, that is very important to know who are carrying the virus and may potentially transmit the infection. But more importantly, I think we're really looking at the symptomatic patients. But even across this spectrum of symptomatic patients, we have those who are only having mild infection, moderate, or severe infection. So you note here the viral load will be higher as days after infection, and may be highest in 2 to 3 weeks, usually even before 2 weeks. So that could be detected. Now, it's all right with those who have symptoms. Then you can pick them up and test them. But what about the pre-symptomatic? Pre-symptomatic means a few days before the symptoms appear. And there are actually studies that show that about 2.2 to 2.5 or maybe up to 3 days before symptom onset, you get a lot of viruses that could be shed and infect others. So it is highest. The transmissibility or virus shedding is highest between 12 to 24 hours before symptom onset. So here, somewhere here. So how to detect that? Now, once the patients have already the virus or they are symptomatic or in the hospital, they may shed the virus for as long as 20 days to around 37 days. And of course, we know that those who die from COVID are also positive for the virus. So understanding that is very important. But now we look at some parameters of the infectiousness model. Um, some terms are actually defined here as well. So we have to understand the incubation period. Now, why? For COVID, it is anywhere from actually 1 to 14 days, but usually it's about 2 to 14 days, and most of the patients will show symptoms by day 5 or day 7. So incubation period is the time the time the virus enters the host. It's the first time that the virus enters the host, and then that is 2 to 14 days later that the patient produces symptoms. Now, in the infectiousness model, we have to also understand the proportion of asymptomatic, so those who have no symptoms, those who are pre-symptomatic, and those who have mild infection. At least in one study, those who have mild infection show that they have a viral load among mild cases less than the severe cases by a factor of 60. So what I said earlier, the more severe, the higher the viral load. So we look at relative infectiousness of these persons, whether asymptomatic, presymptomatic, mild, or severe infection. Then we have to consider the environment. There is that fraction of transmission that is mediated through environment. There are many studies already on how long the virus can stay on plastic, on cardboard, and so on. So that has to be considered in this infectiousness model, as well as the environmental infectiousness. This is the rate at which a contaminated environment infects new people after a time lag. We also have to consider the generation time, which is the time from infection to onward transmission. So, patient one, how long will it take to have his the virus transmitted to patient two? And doubling time is the time taken for the epidemic to double in size during the early uncontrolled phase of the expansion of the infection. Okay, so infection, infectious period, potentially infectious interactions. How contagious is COVID-19? So you hear a lot about R0. Scientists use R0 to describe how contagious a disease is. So this number, this is the basic reproductive number, represents how many people could potentially get sick from a single infected person or vector. During, I don't know, it was probably March, April, we had an R naught of 2 to about 3.1, but at some point that went up. So, what are the attributes or what parameters should we also consider in determining what the reproductive number would be? We have to consider the contribution of the different transmission routes. Yun nga, is that aerosol? Is that by environment? Is it fecal oral or by droplet? We have to look at the distribution of generation times or time from infection to onward transmission. Basically, most of the studies showed a generation time of 5 days, plus or minus 2 days. So incubation period. What's the problem with a long incubation period? You have to quarantine for a long period of time versus, let us say, flu, which is a very short incubation period. You know exactly when you will have to, isolate yourself. But with COVID, it's a very long incubation period. And there are actually reports that some of them may actually present symptoms after 14 days. But those are rare. And we look at the epidemiologic doubling time. Okay, just to show you, I'm no mathematician, I'm more a microbiologist, but it's good to know some numbers. So this is from Ferretti et al. This is from Science. So they did all of these mathematical models, using saying, of course, understanding that infectiousness varies as a function of time since infection for a cohort of infected individuals. Cohort means for each particular population or group that may differ. So because of biological differences between individuals, some individuals may be able to infect few people or may infect many. It is also possible to see that the virus shedding may change and, of course, in a dynamic world, changing contact with others. Now, given an R naught of 2, this was a study that this group of scientists did on 40 transmission pairs. They had to choose the transmission pairs that they can actually follow in a scientific way. And estimated contributions to an R naught of 2 showed that 1, 46% were from pre-symptomatic individuals, 38% of the infections were from symptomatic individuals, 10% from asymptomatic individuals, and 6% from environmental transmission via contamination. So this shows us 46 is the highest, that pre-symptomatic transmission sustains the epidemic growth. Now, what do we want to happen here? Why are you doing contact tracing? All of these measures that the government is taking. We want to lower the R naught to less than 1 or hopefully 0. We want to see the day when the R naught becomes 0. So from an R naught of 2, as I said earlier, I think we had that higher in Metro Manila and in some hotspots in some regions. So we want that. So R naught means one infected individual will infect two. This one here will infect two, that one, so we now have there. And we want to reduce that to 1. I think we're now at less than 1 or 0.95 or 0.99, I don't know. But we want, hopefully, to get to this situation or condition. Okay, so to reduce R naught to less than 1, there are two parameters that we need to look into. This is looking at finding or determining the proportion of cases who will need to be isolated and the proportion of their contacts who need to be quarantined. And for this process to be successful, time is of the essence. So you have to do testing and contact tracing as soon as possible that you have identified your index case. So again, there is this group who did all of these mathematical calculations. So with 0 day tracing delay, meaning today you identify an index case and you start tracing immediately, 80% of onward transmission is prevented. If you delay it to 3 days, only 42% of onward transmission is prevented. And if you delay 7 days, only 5% of onward transmission could be prevented. So, my time is up. I will just have to give you these summary statements, not necessarily for contact tracing, but for everyone to realize that contact tracing is just one of these minimum health, public health interventions that we could do. But basically, what the message that I want to get across to everyone is that the control of the COVID-19 pandemic is in our hands. It is a whole of government, whole of society approach, and all Filipinos should adhere to what the government is trying to do for them. While scientists work hard to make effective vaccines and treatments available, there are minimum health protocols to follow. And it's we cannot just overemphasize all of this, no? To isolate the cases, to do contact tracing, and then quarantine for those who are positive, then or even maybe positive, physical distancing, decontamination procedures, hygiene, and sanitation measures. So, my last message, the ending message, is let us do our share by contributing to end the pandemic and not prolong it. So, thank you very much. Back to Bea.
All right. Thank you so much, Dr. Nina Gloriani, for that very informative and insightful discussion, ma'am. I'm pretty sure a lot of us have definitely learned. And guys, we are being watched not just through the webinar and the offices that are streaming this live, but also in different places across the Philippines through our Facebook Live. And later on, we're also going to be reading some of your shout outs. So, guys, please leave comments in the Zoom webinar group chat and also in the live sections below because later on I am going to be reading and giving you guys a shout out. So wow, we have just learned about the science of contact tracing and grabe powerful jud kaayo ang technology with the projects and initiatives like these. We can really use technology to our advantage. I know we're all hyped up from the first topic and we learned so many things from Dr. Nina, but guys, prepare yourselves because we have more topics and discussions coming along your way. So we're going to take a quick break, just 1 minute to refresh our minds. So, guys, I'll see you back in 1 minute.